Good day, ladies and gentlemen. Thank you for joining Eastern Circle Incorporated Health Educational Corner. I am Dr. Denise Romney, DNP FNP, founder of Eastern Circle Incorporated. This month we will be talking about adult immunization. Stay protected, stay healthy, protect your community. Thank you for participating. Why should adults need vaccines? Well, as childhood immunity fades, new diseases emerge, immune system changes with age, chronic conditions develop, such as diabetes, heart disease, lung disease, and all this increases our risk for diseases. So protecting yourself, also protecting others, such as your family, your friends, and your community, it's important to be vaccinated. I'm going to now review essential vaccines and just do a quick overview. It might be a little lengthy because it's a lot, so just bear with me. For all adults, it is recommended that you get the COVID-19 vaccine, and this is done annually. If you're 65 years and older, you need 2 doses. The influenza vaccine, every 1 yearly. 65 years and older, you get high dose. The RSV vaccine, for 75 years and older, and those with high risk conditions. For at age 50 to 74, you should get vaccinated. And during pregnancy at 32 to 36 weeks, this is in your 3rd trimester, and this is to protect the newborn. Tdap vaccine, it's a combination of tetanus, diphtheria, and pertussin, and this is given once in your lifetime. However, the Tdap vaccine is also recommended every 10 years because your immunity drops. And it's also recommended with each pregnancy. Measles, mumps, and rubella, if you're born after 1957 and you are without immunity, you get 1 to 2 doses. It's also recommended for travelers, and healthcare workers should receive the measles, mumps, and rubella if there is no documented immunity. Varicella vaccine, also known as chickenpox, if you're born after 1980 and you have no immunity, you get 2 doses. However, it's not given in pregnancy because it's a live vaccine. The zoster vaccine is given for all adults 50 years and older. If you are 19 years and older and you are immunocompromised, you also receive 2 doses. These 2 doses of the zoster vaccine is known as Synrex or Syndrex. HPV, which is a human papillora vaccine, you get that vaccine up to 26 years, and it helps decrease the risk of uterine cancer. However, if you never received the vaccine and you're 27 to 45 years, it's also recommended that you can get the dosage of the HPV vaccine. However, you have to discuss this with your provider so they could know the recommended dosage to give to you. The pneumococcal vaccine, you get it at 50 years of age. It's recommended for all persons 50 years and older with chronic conditions. Hepatitis A and B is given to most adults. However, it is recommended for anyone that is at high risk. The Hib vaccine, which is the Haemophilus influenza type B, is only for high risk adults. The monkeypox vaccine is for at-risk groups, and this is 2 doses of that vaccine. The polio vaccine, which is an inactivated poliovirus vaccine is given to at-risk adults and adults who have not been vaccinated. So it's given to at-risk unvaccinated adults. Special situations that adults should receive vaccinations are pregnancy, flu vaccine at any trimester, the Tdap vaccine at 27 to 36 weeks of pregnancy, and the RSV vaccine at 32 to 36 weeks of pregnancy. What should be avoided in pregnancy? The vaccines are live vaccines, such as measles, mumps, rubella vaccine, the varicella vaccine, and the HPV vaccine. If you are immunocompromised, the flu vaccine, pneumonia vaccine, Syndrex vaccine, and COVID-19 vaccine should be avoided because they are live vaccines. If you have chronic conditions, heart disease, lung disease, kidney disease, you are on dialysis, you are a smoker, you should get the flu vaccine and the pneumococcal vaccine, highly recommended. If you're diabetic, the flu vaccine, pneumonia vaccine, plus the hepatitis vaccine is recommended. If you have liver disease, hepatitis A and B is recommended, including the pneumococcal vaccine, the pneumo vaccine, all highly recommended. Common questions asked about vaccinations are, number one, are vaccinations safe? And the answer is yes. It is tested, it's researched, and it's monitored for years before the FDA approve the vaccines. And disease risks are much greater if you are not vaccinated. What are the side effects of the vaccine? Most vaccine side effects are mild. You get sore arm, fatigue, a low fever, and they only last a couple of days, like 2 to 3 days. Third question is, can I get several vaccines at once? And the answer is yes. It's safe and more convenient. Is natural immunity better? And the answer is no. Diseases can cause severe complication or death. And it's much better to receive passive vaccination than active vaccination because you have to wait for you to develop the immunity. And that is when the severe complications and death can result. The final question is why vaccinate for rare diseases? And the reason is because they return when vaccination rates drop. So, ladies and gentlemen, there are many questions that are asked, but these are the 5 common questions that we choose to address about vaccines. So what do you do next? You check your vaccination records. Talk to your doctor, your nurse practitioner, your pharmacist, because now you can get vaccine at any pharmacy. So you speak to your pharmacist about the recommended vaccines. Stay updated. Every year, make sure you get your flu vaccine and your COVID-19 vaccine. Protect yourself, protect others, protect your family, your friends, your community, your workplace, colleagues. Thank you again for tuning in and participating in Eastern Circle Incorporated Health Educational Corner. Our aim is to educate you on health promotion, disease prevention, and chronic disease management. See you next month when we come with another health topic. Thank you.